Hey guys, so discussion number 4 is on mental illness. I think normal is different for everybody regarding their mental health, like their baseline, what they feel most of the time. But I think that crazy is when someone's mental health impairs their judgment to the point that they're making stupid or rash decisions, potentially harmful decisions to themselves or others that they normally wouldn't make. And I think mental illness is when a person's mental health gets so bad to the point that it's impacting their ability to live and exist as a human. Like, they can't go a day without having some sort of negative thought, whether it's about themselves, the situation they're in. Like, they just are weighed down in any negative aspect. To reduce the stigma of mental health, I think that it needs to be researched more. There needs to be more studies done on it. We need to have a better education of it because there's so much we don't know about mental health. And the more we know about it, the more we can fight it and, develop new medicines, new treatments, whatever. I definitely also think it needs to be talked about more openly because there's such a bad rap. Like, if I say that I have depression or anxiety or whatever it is, people say, oh, you have mental health problems, you have mental illness, like, what's wrong with you? I don't want to get it. Like, there's such a bad rap about it. And yes, mental illnesses, they are bad things, but that doesn't make someone who has one a bad person. So I think it needs to be talked about more openly. In my family, specifically my dad and my father, they very much believe that men don't have feelings. They're not allowed to. They need to shove them deep down and deal with it on their own. They can't talk about it with anyone. My boyfriend, on the other hand, he was raised in an all-girls household, and he was raised that, if something's bothering him, he needs to talk about it. If he feels depressed or anxious or anything else, he needs to talk about it so it can be fixed. He shouldn't have to sit and deal with it. And my dad is so critical of this. He thinks that Kyle is weak for that and that he needs to just man up and deal with his feelings on his own. But I think it needs to be talked about and understood better, because if we have an understanding of it, and if we have an understanding of each other and what's going on in each other's lives, like, we can just better understand each other as people, as humans. Because at the end of the day, that's all that we are. We're all humans. Should we give medicines to treat mental illness? I do think that medication should be used to treat mental illness, but I don't think it should be the first option explored. I definitely think therapy should be tried first. And it's not going to work for everybody. I believe that most medications are acceptable and ethical to treat mental illness, and they should be given, if helpful. I don't think that, like, hard drugs like opiates or cocaine or meth or, like, any pure, just raw drug should be used to treat any medicine, because that can just lead to more problems and addiction. But, like, drugs that are, like, pure natural drugs that are combined with something synthetic or man-made, like methylphenidate, or like dexmethylphenidate, which is the same thing, pretty much. Like, if it's combined with something else in a controlled small amount, I think that that's acceptable. And I absolutely think that mental illness is sometimes over-medicated. I think that medications are seen as an easy fix, and that if you just take this pill, all your problems will go away. But that's definitely not true. I also think that sometimes too much of a medication is prescribed, which can lead to bad complications. I've actually had this happen a couple of times with the different medications I've been on. The most recent was my ADHD medication. About a year ago, I started taking methylphenidate, and I started on just the basic 5 milligrams, and that wasn't really enough, so I went up to 10, then 15, then eventually 20. I was on 20 milligrams for about 8 months, and when I took it, I felt so terrible. I was nauseous, I wasn't hungry at all, so that led to an eating disorder. And people would tell me that I didn't seem like myself. I described that as like losing my sparkle or like my joy. Not too long ago, I switched to a similar medication. It's called dexmethylphenidate, and I'm only taking 5 milligrams, and I feel the best that I ever have. Like, I don't understand why instead of switching me to a different medication when they realized that that first one wasn't working, they just kept giving me more and more and more. Like, sometimes you have to switch medications in order to get the desired effect. So yeah, I definitely believe it can be over-diagnosed and over-medicated. And we over-diagnose mental illness. I think that sometimes people who have, like they say that they feel sad. Like, yeah, it's normal to feel sad, especially if, like, your dog dies. Like, that's totally normal and acceptable to have a sad feeling. But sometimes feelings like that, like sadness, or if you're anxious, like the professor has talked about, if you have a test upcoming, you're gonna be a little anxious. But you shouldn't have anxiety for no reason, and you shouldn't have feelings of sadness for no reason. So I feel like people will feel sad or anxious or hyperactive, but that doesn't necessarily mean that they have a mental illness. Like, there's just a fine line, and you have to, doctors definitely need to not just, oh, here's what you have. Like, because people want an answer as to what's wrong with them, why they're feeling this way, and doctors just give them what they want to hear, but that's not necessarily always what's going on with the person. So yeah, that's it. Thank you.